Thank you, Brian. I'm Joe Watson, the chair of the Adena Health System's Board of Trustees. And finally, the day is here, snow and all. I want to congratulate the leadership teams and the board members at Fayette County Memorial Hospital, Adena Health System, and the county commissioners here in Fayette County. Thank you very much for your leadership. This is indeed an important day in the evolution of healthcare close to home in our region. You know, more than 125 years, Adena was founded on the principle of delivering quality healthcare close to home. That principle remains as true today as ever before. In fact, it's our North Star. In today's competitive healthcare environment, where we're surrounded by giants, rural healthcare organizations must be properly aligned to ensure stability, encourage innovation, and to expand access of quality care here close to home. Adena and Fayette County Memorial share those goals and commitment to improving the health of our families and our neighbors. It is for this reason, as the board of Adena discussed this agreement, we worked through the due diligence process and it became very clear to us. This agreement perfectly aligned with our mission. Therefore, let me be the first to say, on behalf of the Adena Board of Trustees, we welcome Brian and Mike and the entire Fayette County Memorial family to our Adena family. Welcome.
Thank you, Joe. I am Mike Diener, CEO of Fayette County Memorial Hospital. I'll give you a fair warning. I've developed a reputation with my staff of getting a little emotional when I talk about things that are important to me. This is very important to me, but I'm going to do my best. I know I got some folks back at the hospital placing some wagers this morning, so I'm going to try to foil their plans. I want to emphasize that this is indeed an exciting day, and I want to express my gratitude both personally and on behalf of all of our Fayette County Memorial Hospital caregivers to our Board of Trustees for their leadership, the county commissioners for their support, Jeff, Joe, the Adena Health System for their commitment to FCMH and the residents of Fayette County. A while back, some folks who have demonstrated a great passion for the work that we have done here in the county over the years began sharing pictures and mementos of Fayette County Memorial Hospital they had collected. Many of those pictures, which were being kept in boxes and albums, are now hung in our administration hallway for everyone to see. As I consider the impact of today's signing on our current caregivers, I can't help but think of the faces of those in those pictures. Community members who gathered, planned, sacrificed, and worked to create a hospital that would outlive them, just to provide a place for their community to seek help and healing. And for the past 70 years, many have joined to ensure this work of caring for Fayette County continues. As a relative newcomer to this organization, it didn't take long for me to quickly learn the names of Doctors Gebhardt, Heine, Anderson, Gay, Hancock, Shaw, Lorente, and other key leaders in our history who devoted large portions of their careers and their lives to ensure that the residents of Fayette County didn't need to drive long distances to unfamiliar cities to receive quality medical treatment. As I think about them today, I can't imagine how excited they would be to know that their legacy continues and that there is a bright future ahead for the hospital that they loved. And for our current caregivers, I am both thrilled and honestly a little relieved. 70% of our staff live here in Fayette County. Their decision to work here may have been influenced somewhat by convenience, but I believe it is truly driven by a love for community and a desire to do something good for people that they know and love. Since 2010, over 100 hospitals have closed across the country. many of them small, rural facilities similar to ours. When a community loses a hospital, it is more than just lost jobs and lost tax revenue. It is the loss of the privilege to be cared for by family, friends, neighbors, folks who know you and understand in personal terms the impact an illness is having in your life. Some may not realize, but just 1 year ago, we were dangerously close to a fate similar to those shuttered facilities due to the early impact of the COVID pandemic. There were several weeks when our future looked very uncertain, if not bleak. Although we are in better shape now, it is clear that there remains rough seas ahead. Tides and waves that a small ship like ours will continue to have trouble navigating. Our membership in the Adena family will bind us to a larger, more stable system with a culture very similar to ours that will help ensure that we can survive rough waters. And not only survive, but provide a foundation from which to build and grow, giving our employees assurance that our organization is stronger, their jobs more secure, and at the same time providing them greater opportunities to develop their skills and expand their careers as they continue to care for Fayette County. I firmly believe that in the same way a person joins the mission field in answer to a call, the decision to pursue a career in healthcare is a response to a calling. Our physicians, nurses, therapists, techs, assistants, dietary, environmental services, and facilities personnel all show up every day, blessed with the opportunity to exercise that call and make someone's life better. The events of today will provide further guarantee that our caregivers have a place to do what they do best in a community they call home. Jeff.
Well, good afternoon, everyone. And it is a pleasure to be here today. And, you know, some of the things that come out of COVID is like this technology. And, you know, with the weather that's out there today, we're able to still celebrate and share with this technology without having to travel the roads. And so I'm very, very happy to be able to have that here today to share with the great announcement that's happening between two organizations here today with Adena and Fayette. I also want to recognize the County Commission, the Board of Trustees, Mike, your team, and the leadership team, along with the Board of Trustees of Adena and the leadership team at Adena, and all the work that they've done in getting us to this point. And there's been a lot of work that has been done during this due diligence period. So this is truly a historic day for both organizations. For Adena Health, our healthcare system is growing, and that means the ability to extend even more access to great care to the residents of Fayette County. Strong regional networks are vital in today's healthcare. Fayette County Memorial Hospital, by becoming a part of the Adena Care Network, they will enhance, they will grow, they will strengthen the hospital, and taking it well into the future for the residents of Fayette County. As you've heard others speak here today, you know, the future with healthcare at times can be very bleak. And I'm very fortunate to have the opportunity over the last couple of years to be able to work with Fayette County Hospital, the Board of Trustees, and bringing Adena together in a focus that we take very seriously, and that's our partnerships. Our partnerships in strengthening communities, keeping the care local, and being able to be there when our community needs us most. So it's a very, very exciting day that all this is going to happen. And I'm very excited to announce that what we're about to do today is sign agreements where Fayette County Memorial Hospital will be becoming a member of Adena Health System. The signing of those agreements today will become effective on May 2nd. But Adena today is also signing an operational management agreement, which will become effective today. And so that means that we're one step closer by joining together today in preparing for what will happen on the transaction date of May 2nd. You know, Adena is not a stranger to the community of Fayette County. We actually have been in the community since 2012, and we became an affiliate partner with Fayette County Memorial Hospital in 2018. And today, we are committed even more than ever to the residents of Fayette County. You know, when Mike and I first started talking about our strategic priorities and what would that mean in Fayette County, and I was very clear, we're here to partner and support. We're not here to compete. We're here to bring care and access and keep it here in this community because it's even bigger than the care. It's about keeping the local jobs in the community. It's about having the future of this hospital continue to grow and to be able to bring new services into the hospital. And it's been very exciting to watch over the last couple of years with the expansion and the partnership with our cancer care. Also bringing our specialists into the medical office building and being able to expand services and bring growth back into the hospital. But let's talk about the future of healthcare at Fayette County Memorial Hospital. As we worked through our due diligence over the last year and a half, a key component of this agreement and what the future holds for the physicians, the advanced practice providers, and caregivers at Fayette County, Fayette Memorial Hospital was at the center of the discussion and around the residents of Fayette County. Through our course of due diligence, we looked at the investment needed to take the current hospital facility and prepare it for the needs of today, but more importantly, for the future of tomorrow. And it really changed our discussion. We shifted our talks about what the future of healthcare in Fayette County was going to be and what could it be. But more importantly, what could it be for all the area residents of Fayette County? As I said, we've been completing our due diligence since the fall of 2019, and we thought we had a great plan. We thought that, you know, the plan that we had been working on and through COVID and then the pause of our due diligence work, you know, when we got back together, we thought, you know, this plan, it's good. But we started having the bigger conversation and we dusted those original plans off and we actually came up with a bigger plan and a plan that I'm very excited to share with you. So, I'm excited to share with you the future plan for Fayette County Memorial Hospital. And that future involves building a new state-of-the-art replacement critical access hospital on the current site. The new facility will provide physicians and all caregivers with facilities and equipment to deliver outstanding quality care now and well into the future. We understand the impact localized healthcare has on a community, and we're committed to that. And how a new hospital also helps drive the local economy. Having state-of-the-art facilities that will allow new services here at Fayette Memorial Hospital. I don't have the details and all the details to share with you today on the new hospital at this time, but we've already started working on those. And you will continue to hear more throughout this year with an exciting announcement of when we're going to break ground here in the very near future. And they will be becoming available to you later this year. Our goal at Adena Health is to continue to expand our network and grow the care here and not have people have to leave their county for care or in their time of need. And both organizations are committed to a seamless transition for the providers, the staff, and the patients. So with all that being said, let's get to the real reason why we're here today, and that's to sign these agreements. So gentlemen, are we ready? How did I get stuck with more papers than everybody else? Okay.
All right.
So I want to thank everyone for being here today. And in this world of COVID, we probably right now would get up and do a lot of hugs and shakes. So we're going to do what we've been doing in COVID, and it's like, let's do the high five, everybody out there, and finish with a round of applause. I look forward to the future and what we have in store together and bringing great care and facilities to this community. So thank you all for being here, and that concludes our program for today.